Hi there, I'm naturopathic Dr. Joelle, and today we're going to talk about solutions for low back pain and stiffness. If you've been doing a lot of sitting lately, I know I certainly have, these rolling exercises are going to be wonderful at helping to reduce the risk of discomfort and or pain. Now we are going to use a foam roller, and you can pick these up at physiotherapy stores. I'm also going to give you a link, and we're going to be focusing on 3 targeted areas. We are going to cover the low back area, which we all know has been a problem for those of you if you've been doing a lot of bending or not really focusing on strengthening your core. Then we are going to cover the quadratus lumborum, or QL, which tends to be an issue if you've been doing a lot of turning and or lifting. Lastly, we are going to cover the thoracic lumbar junction, and this can be an issue if you've been doing a lot of typing, if you have been doing a lot of driving, and will help to reduce the risk of hunchback. So in order to get started, all we're going to do is we're going to start with number 1. We're going to do 2 variations in each targeted area. And so the first is a general roll. And we are going to focus on the low back. So we're going to put the roller just above the hips in the low back region. And then we are going to make sure that we protect the back, knees bent, and we're going to use our feet to help create a rolling motion. And then we are going to roll 10 to 15 times in this location, and that feels really good. And then the next variation of this particular exercise is called a compression. So we are going to be targeting problem areas, and all we do to access this is we are going to place the foam roller on our low back, and then we are actually going to allow our upper back to rest on the ground. And then we are going to allow our body weight to sink into the foam roller and use deep breathing. And we're going to continue on for a total of 8. And then once you finish this location, you can move the foam roller so that you're in another location. Just being careful not to hit the floating ribs. And then we are going to continue the deep breathing and the compression rolling. Now, the next targeted area is going to be the QL. And again, this can be problematic if you've been doing rotating, and this will be an issue if you've been shoveling snow or something like that. So for the QL, the way we access this is that we go back again onto the foam roller in the low back area, and then we bend the side that we want to target, support the head, and use compression. So again, we're going to breathe. We're going to take 8 breaths. And continue on. Now to do the QL roll, what we do is we actually, again, put the foam roller in the low back area. We are going to have our knees bent. We are going to protect the head, and then we are going to roll over onto the side that we want to target. And we're just going to create a nice rolling motion. And that is always a tender spot for me. I'm not sure about you. So those are the 2 variations for the QL. And then lastly, we're going to head into the thoracolumbar junction. And so this can really be an issue if you, again, have been doing a lot of typing or driving. So this is a really important roll. So what we're going to do is put it in our mid back, and then we are going to protect the head, and again, use our legs to help roll out this section. And this feels really good. So we're going to do 10 to 15 in this area. And then after we finish that, we are going to move into the next variation for this area. And we are just simply going to, again, use compression. So we are going to put the foam roller in that mid-back section, and we are going to allow the weight of our body to actually hit those targeted problem areas. And we're going to take 8 deep breaths. you're going to continue for a total of 8. And then you're going to rotate or move the location in terms of the roller, targeting another spot. We're only going to hit about 1 to 2 spots in this particular move, and just repeating the breathing exercises. And that, my friends, is the total of the 3 targeted areas that will be very helpful for low back pain and stiffness. And again, we have covered the paraspinals, we've covered the QL, and then we've covered the thoracolumbar junction. There are many ways to approach back pain in an integrative fashion, including nutrition, so nutrient testing, and we know that vitamin D deficiencies can create a lot of joint pain and stiffness. And then there's also inflammation, so we want to look at those markers. There's neurotransmitter testing for any kind of stress relationship. So ideally, we want to create a real integrative approach to any kind of pain or discomfort. So I've really enjoyed bringing these tips to you. Happy wellness, and we look forward to chatting with you again.